discussion of the recent changes and their impact on the roles and responsibilities of the registered nurse. A registered nurse, RN, is a person who has undergone a detailed programme of study, acquired the appropriate qualification and be registered in the Nursing and Midwifery Council's NMC register. The role of the RN has changed considerably over the years. However, care remains the key factor. Nurses must have a caring attitude and responsibility. The RN role has greatly expanded from being the doctor's assistant on the ward and providing basic care to becoming advanced practitioners, diagnosing, prescribing, treating and educating patients. Previously, nurses were obedient and provided care suggested by the ward sister. Today, nurses can be autonomous practitioners, work with research-based evidence, and have become a respected profession. They have become specialised rather than provided general care. Due to the increase in patient turnover, increase in population and a reduced amount of time spent in hospitals, nurses have had to change in as much that they have had to be more educated on complex diseases and treatments, rather than simply spending weeks with the same patients. Nurses are now involved in preventative care, such as health promotion and education. And nurses are now able to be independent practitioners. Through extra training and education, nurses can offer very specialised care. For example, the A&E. Nurse practitioners are able to assess individual patients, conduct investigations, analyse the results and make a diagnosis. From this, they can plan a care package which includes treating and prescribing medication. A specialist nurse in dermatology can assess, diagnose, treat and even perform minor surgery. Other specialist roles include managing drug and alcohol centres, where the specialist nurse will assess, plan and deliver treatment without any doctor involvement. This is a huge leap forward in nursing from the days when they were told what to do by the doctor or ward sister and deliver non-evidence-based care. In fact, senior and specialist nurses are involved in medical training for future doctors. The role has changed in as much as there are now 4 different categories of nursing: adult, children, learning disabilities and mental health. These categories have provided a huge sphere within the nursing practice. Each speciality opens up a vast area of practice. In adult nursing, the nurse can work in hospitals, in the community, in care homes, GP practices. Within the adult nursing, there are further specialities such as acute medicine, surgery, endocrine, elderly, haematology, to name but a few. Children's nursing is also able to be in hospital or community based, and again have similar specialities as adult nursing. Learning disabilities offer roles in the community such as residential homes and work closely with social services. Mental health nurses can work in a hospital setting, visit clients at home, work in community facilities such as alcohol and drug units, adolescent centres and prisons. It is very clear that also nursing is still seen as a vocation. It is very much a professional role requiring many skills, qualities and dedication. This shows the 6 C's that are required to be an effective nurse. Care. You need to have people's best interests at heart. Compassion. You have to be empathetic. Competence. You have to be confident in your skills and knowledge to care and know when to stand back. Communication. You have to have excellent communication and interpersonal skills, and where needed, using a translator. Courage. Willing to stand up for your patient and report malpractice. Commitment. You have to give everything and are willing to work in difficult and challenging scenarios. A discussion of the role of Nursing and Midwifery Council in relation to nursing practice. The NMC is a regulatory body which maintains a register of all qualified nurses and midwives. It sets a standard for training, education, practice, and its guidelines are embedded in the law. The Health Act, Gov 1999, provides a framework for the NMC. The NMC is there to provide a safety net for nurses and the general public in ensuring everyone on the register is fit to be on it and conduct their job safely. Process of applying to be on the NMC register. University will upload course and personal details to the NMC database. The individual is to send a declaration of good health and character. You then create the online account and pay. The NMC Code 2015 outlines the standards that must be adhered to in order to practice as an RN. Its 4 main themes: prioritising people, treat as individuals, putting patients first and prioritising their needs, ensuring equality and diversity is respected, Respect patients' wishes and treat with kindness and respect. Be empowering and compassionate and provide holistic care, physical, social, psychological and spiritual. Maintain privacy and confidentiality. Practicing effectively. Provide care in line with current research. Provide excellent verbal and non-verbal communication skills. Provide alternatives where required, translator, hearing leap, writing paper. Work with others to provide accurate information and collaborative care. Help to train staff, be a reflective practitioner to develop yourself and others. Ensure accurate record keeping. Ensure you are accountable for your actions and choices when delegating work to others. Have indemnity for your nursing practice. Preserving safety. Only work within your own competency and be willing to say no when you are not comfortable when delivering a task. Be honest about a care provided even when a mistake has been made to ensure that it can be rectified. Duty of candour. Offer help in any emergency setting within your competency. Act quickly if your patient's safety is at risk. Ensure that medication is only supplied and administered within your competence. You need to maintain a safe environment. Promoting professionalism and trust. Maintaining professionalism at all times, including when not at work, which includes not accepting gifts or loans from patients. For fill registration, nurses have to re-register every 3 years and demonstrate appropriate training and development to demonstrate safe practice. Revalidation requirements for the NMC. 450 practice hours or 900 hours if reviewing 2 registrations. For example, it's both a nurse and a midwife. 35 hours of CPD, including 20 hours of participatory learning, 5 pieces of practice-related feedback, 5 written reflective accounts, reflective discussion, health and character declaration, professional indemnity arrangement, usually from a union like the RCN, confirmation. Nurses must ensure that they uphold the NMC's code to ensure that standards are maintained. They remain professional, work with their competency, laws and policies, must be an advocate for their patients. An analysis of the implications of the code on nursing practice and the role of a registered nurse. The implications are many. The code is there to protect both nurse and patient. If a nurse does not act in accordance with the code, they can be investigated by the NMC and, if necessary, removed from the register, thus will not be able to practice as a registered nurse. For example, if a nurse is found to be stealing from their client, not disclosing criminal convictions for indecency such as battery and assault, the code should be encouraged all nurses to reflect on their practice, taking action where required. For example, if a drug is given in error, the nurse has a duty of care to report such, so that assessment and treatment can be commenced as required. However, the NMC are presuming that all nurses are honest and will act on any misadventures. Unfortunately, it isn't possible to ensure that everybody reports any errors. Some nurses may be too frightened and worry about the repercussions. Some may not realise they have administered the wrong medication. There is a lot of trust from the NMC. Unfortunately, there may always be criminals within any profession. In 1991, Beverly Allitt attempted to kill 13 children, 4 of which died. This crime went unrecognised. It was only after the 4th death that medical staff became suspicious and the police were called. Another example of this is when poor practice becomes common practice and is acceptable by the majority. Mid Staffordshire NHS Trust are a prime example. Campbell in 2013 states that over a 50-month period, between 400 and 1,200 patients died as a result of poor care. The Francis Report 2013 identified that, amongst others, the NMC failed. It has since updated its code to include the duty of candour, revalidation, education. It is up to individuals to be accountable for their actions and report failings where necessary. Example is poor staffing levels, lack of training, poor practice. This is where courage is particularly pertinent, as it takes a strong will to stand up and report malpractice or to stand up for your client's rights. Clinical governance as a programme to sustain and improve care through education, personal and professional development, PPD, clinical audit, measure of quality of services against a standard, changing where required, staff and management, highly skilled and trained staff, teamwork, and reflective practice. research and development, National Institute for Health and Clinical Excellence, provide national quality standards and guidance on evidence-based practice, openness, patient and cared input and feedback, risk management, what can go wrong, learning from errors, systems to reduce risk. This process should enable staff to complete an accident or near miss form, which should be investigated by the Care Quality Commission, the CQC, and changes implemented if required. However, again, this will only be effective if staff are honest or if they are aware of the poor practice. Near miss forms are now a common practice and help hospitals and other care centres change protocols and practice to prevent such events from reoccurring. An explanation of the need of effective communication in a multidisciplinary healthcare setting. Effective communication is essential for consent, informed consent and written consent, providing accurate information on care and treatment to ensure the best outcome for patient, relatives involved and informed. Collaborative working, the MDT working to prevent mistakes and provide seamless care, reduce repetition, time and costs. Safe practice, clear verbal and written instructions, communication prevents errors. Equality, diversity and rights, treat all individually, respectful of belief, culture and language barriers. Accountability, ensure that the nurse communicates clearly to prevent mistakes. An evaluation of the effectiveness of the multidisciplinary approach in the healthcare setting. Multidisciplinary, the MDT approach, is essential to provide the optimum care, prevent repetition, reduce waiting times and costs. Effective MDT working helps to bring together differing disciplines to ensure a holistic care package is provided. It is essential that the MDT work together with each other and with each member offering up their specialism to enhance care. Smooth MDT work enhances the care experience and ensures that all areas of care are catered to in a cohesive way. Communicating together helps prevent a repetition of treatment. It reduces the amount of time a patient will have to wait, thus reducing costs. An effective MDT approach will ensure that the patient has a supportive and well-planned care package providing optimum care and treatment. An example of effective MDT working is when a patient who has suffered from a severe stroke is to be discharged home. The MDT, which will include the ward nurse, community nurse, physio, occupational therapist, social worker, doctor, and the patient and carer or relatives. The team will discuss all care requirements and set up a cohesive care package and ensure everything is ready for the day of the discharge. For example, hoists and a hospital bed installed, ramp and wheelchair access, community care for washing and dressing. Unfortunately, there are many people, personalities and differing opinions within the MDT. It is vital that each member is allowed to speak, contribute and not be spoken over. Some people are much stronger at getting their over and do not listen to others or belittle their involvement, thinking that they are less important. Successful MDT working is dependent on finances. If the budget is lacking, a cohesive MDT provision may not be available and they can be a timely exercise. This will lead to a breakdown in the cohesive package and can lead to inadequate care, provision, miscommunication of essential information. For example, a patient may be discharged but the district nurse has not been informed, or as in the recent case of Star Hobson, a 16-month-old child killed by her mother and father. Social services were contacted 5 times and a failure of communication within the department led to no action being taken. It is possible that if there had been better communication, the death may have been prevented. Another example, when any part of the MDT approach fails, I refer to the client who had suffered a stroke. The client can end up staying unnecessarily longer in a hospital bed and block a bed. Their hoist may not have been arranged, caregivers may not have been informed of a discharge date. Communication and collaborative working is key and is one of the 6 principles that guide the NHS. Clinical pathways can provide a quick access to evidence-based practice and treatment plans. They can help guide the MDT and ensure consistency. They provide a flow chart to direct what care is to be delivered, by whom and when. Example of a care pathway shown here. The structured MDT approach is used, it can help empower the patient and help them lead the best life possible. The nurse is able to act as an advocate and show care towards the patient and treatment outcome. Therefore, it is essential that the patient is fully involved, thus giving them full access to a wider range of service provision. It is clear that nursing has vastly changed since its inception. It has become a respected, educated profession rather than the original doctor's handmaiden. Nursing has expanded into differing fields such as mental health and is equally a career for men as much as it is for women. Care is now evidence-based, and through regulation via the NMC, nurses must be accountable for their own actions in care. They must be a reflective practitioner, a good communicator, team player, and care should be at the centre of all treatment. As indicated in the profession, failures in practice still happen and it's difficult to recommend how to stop criminal behaviour. Further encouragement on reflecting on individual and others' practice needs to be reinforced in an attempt to prevent any criminal or negligent care. Continuous auditing and monitoring of practice will hopefully also help to reduce malpractice.